Hi, I'm Dr. Trevor Murray, and helping patients find relief from TMJ pain is probably one of the most fun things I do. We have patients who have headaches, we have patients who have migraines, we have patients who have vertigo, we have patients who have had seizures, we have patients neck pain, back pain, tingling in the arms, ringing of the ears, jaw pain, clicking, all those symptoms to give them relief, to give them hope, to help change their lives has been remarkable. One patient that comes up, she had vertigo and she's laying back in the chair, and I'm like, "How would you like to take care of that?" And she's like, "Oh my gosh, it's ruining my life." I have a video on Instagram where she's like, "Ever since I started treatment with Dr. Murray, no more vertigo. Things are great. I feel wonderful." That isn't the case all the time, but most of the time we can really help patients and make a difference in their lives. And that's it, is making a difference in people's lives and helping them and giving them hope. I would describe TMJ disorder and the symptoms that they overlook as most people think it's normal. I had a patient today. She thinks it's normal to have a headache. She thinks it's normal to have ringing ears. She thinks it's normal her jaw pops because her mom's jaw pops. She thinks it's normal to have neck pain, back pain, shoulder pain, problems sleeping. And those are the common symptoms: neck pain, migraines, headaches, back pain, ring of the ears, sore jaw, tenderness through the jaw and neck. They just think it's normal. So when we're able to give them answers and give them hope that we can help, it's a pretty cool thing. The most common cause of TMJ pain is misalignment of the teeth. And so because of the misalignment of the teeth, oftentimes it's an overlap or overbite, or sometimes it can just be trauma from a patient that fell or was hit or injured when they were little. And so because of all these things, um, there's a lot of trauma in the TMJ joint and all through the jaw. How I diagnose TMJ problems and how we do the evaluation. We do a 3D scan of the patient, and with that 3D scan, we can see where they have broken teeth, cracked teeth, issues. Most patients that have issues with their teeth, with cracking and breaking the teeth, usually have some kind of TMJ issue, along with a lot of times they'll have migraines, headaches, etc. What we do is we just evaluate the teeth. First of all, we look for overlaps, we look for grinding, we look for issues with the teeth. And when we see those, we usually that's an indicator they may have a TMJ problem. The other way that we evaluate things is there's a muscle, and I'll show you this model. There's a muscle, it's called the lateral pterygoid. And what we'll do is we'll slide our finger all the way back and we'll push on that lateral pterygoid muscle. That's the muscle that serves as a cushion for the TMJ joint. I know it's probably hard to see on video, but we're looking at this little blue thing right here. We want that to be in the right place, and we want it to be not inflamed. So when we push on it and it's inflamed, we know they have a TMJ problem, and that muscle that serves the cushion is being irritated. As soon as we see that, we know that we can give them relief. If they have headaches, jaw pain, ring of the ears, clicking, popping, we can give them a chance that they're going to get better and they're going to feel better, and it just makes a difference. So as we're doing that, it's pretty simple. That one muscle usually, which is called the lateral pterygoid, which is a really funky muscle, that is what gives them, when we get that better, then they get better. The treatment we offer for TMJ relief is Invisalign. It's a non-traditional treatment, but it's a holistic treatment where there's no shots, there's no injections, and there's no drugs. We actually realign the teeth, which people do all the time through orthodontics. We use orthodontics, and we move the teeth to the right place. When we move the teeth to the proper place, it decompresses the jaw, decompresses the TMJ joint, and starts giving the patient relief, and they feel better. Patients that have even been locked up, they're locked open or locked closed, we're able to get them an appliance and get them feeling better quick. We've had great success with it. And like I said, the best thing about it is a very holistic approach where we're not doing something where we're using a scalpel, we're not using a drill. All we're using is their own teeth to reposition their jaw and put them in a better place. And so they find huge relief in that. And we've done it for years and years. And so we know there's a great success in it. Are there any lifestyle changes or habits that would help them feel better in the long term? Lifestyle changes that they can do. One thing is just relieve stress. So stress makes TMJ problems worse. And so anytime there's stress in a situation, it makes everything worse. Other things they can do is they can change their diet, decrease dairy intake, which often causes inflammation, decrease gluten intake, which often causes inflammation. The other thing is we recommend is them having a uh, sensitivity test. So if they have sensitivities to food, which they probably don't even know about, there's some simple tests out there that are inexpensive that they can get tested on. And if they can stay away from foods that cause inflammation in their body, such as sugar, sometimes even things like fruits, vegetables that you wouldn't even think of, can cause inflammation. So things that cause inflammation exacerbate the symptoms of TMJ and make things worse. I had a patient that couldn't get out of bed. She couldn't function. She could not move. Um, she could barely even just take care of her kids. She was a huge athlete. She did previously marathons. Um, she did Ironman, triathlon. She did all those things, and she couldn't function. And so, after seeing me initially, her symptoms were not very bad. She came back and she had the TMJ treatment, and now she's doing 100 mile rides. She's doing all kinds of stuff. The funny thing about it is she sent another patient, and that patient was a nurse. She just got out of the hospital. She had all kind of tremors and basically just tremors and couldn't function. Same thing. She couldn't do her work. She couldn't take care of her family. And she came, her mom drove her from the hospital, drove her here, and we treated her, and she is 100% normal now. She has no more tremors, no more, she called them vibrations. And those are some unusual patients, but it's amazing how getting the TMJ joint in the proper position can um, eliminate a lot of unusual effects that you would think, wow, that how would that have anything to do with teeth? Um, and it does. It is simply amazing. If you are tired of jaw pain, headaches, clicking, give us a call. Email us here at Allure Dental. Give us a call, Allure Dental, and let us have a chance to give you hope. Let us at least evaluate things. There's no risk. It takes a little bit of time and see what's available. Um, we have changed many lives and we have great success. And it is a thrill to help people do that when I'm just a simple dentist and to make a difference in people's lives. It's amazing.